Okay, so if you're a 27-year-old woman.
Hold on, let me start writing. Okay. Okay. 27. Mm-hmm.
Yeah,
Female. Okay.
yeah, 27-year-old woman, difficulty hearing on the right
Mm-hmm.
side.
Mm-hmm.
So what's causing that?
Just 27-year-old woman with difficult hearing on the right side.
That's
That's all you're giving me.
most common, yeah, what do you think?
It can be anything. Come on.
Okay, when I place the tuning fork on your right mastoid for 10 seconds, you can hear vibrating sound. Okay, but when the vibrating fork is immediately placed near your external auditory meatus, you can't hear it, okay? Now, what do you think?
So I hate all those things. So this might be, what are we, what is this test now? Is it conduction or is it
Conductive hearing loss. So what is
conductive hearing loss? Conductive hearing loss can be a lot of things. It can be due to trauma. It can be due to infection. It can be due to cholesteatoma. Some things, I don't know.
Yeah, in young, yeah, there is something common in young. It's otosclerosis.
Yes.
Yeah, that's like some ENT question with the endocrine. Okay, now back to endocrine. Now, okay, now what is the which patient most likely develop hypothyroidism after radioactive therapy? What disease caused that?
Maybe like Graves,
Yeah, Graves' disease. Yeah,
diffuse, yeah.
good job. Yeah. So if you're a 45-year-old woman with constipation, abdominal pain, urinary frequency, and constant thirst. Okay, you're in diltiazem and warfarin.
Hmm?
Yeah. So what's causing that? What's going on? You've been,
Constipation,
you've,
urinary frequency.
yeah, you've been trying very hard to lose weight, and you attempted various fat diets for the past 6 months, and now you have constipation and thirst. So what's your diagnosis?
Hmm. Do you say weight gain or weight loss?
Yeah, you were trying different fat diet
Mm-hmm.
to lose weight. And you lost a lot of weight during this time.
Okay.
Yeah. So what's
Maybe
good?
the patient is taking a thyroxine supplement. But
Maybe.
that is going to give you diarrhea, though. So I
Yeah.
don't know. This question is a little weird.
Yeah. So this when they describe that someone taking fat diet, then you think of vitamin D toxicity. Okay, vitamin D
Interesting.
overdose. Okay, this is a good one. They're taking a lot of vitamin D. That's why they have hypercalcemia and constipation. Okay. Okay. Now, if you're a 36-year-old male with fatigue, headache, decreased libido, your prolactin is 35. So what's going on here? Your testosterone is low. Okay.
Yeah,
TSH is
maybe
TSH is low. T4 is low.
TSH is low. T4 is low. Maybe prolactinoma. I don't know.
Yeah, it's a pituitary adenoma,
Mm-hmm.
not prolactin. Prolactin will be more than 200 prolactin.
Pituitary adenoma. Okay.
Yeah. Let me see just a second. Okay, yeah. So what are the common causes of hypogonadotropic hypogonadism in men?
So it can be like Kalman syndrome.
Okay, what else?
Mm, hypogonadism is also can be due to steroid use.
Okay,
Mm,
what else?
hypogonadism, hypo. Yeah, so inherited common syndrome acquired. It can also be like a pituitary tumor can also cause that. That's all I know.
Yeah,
Can be due to
could be.
tumor.
Yeah, it could be due to gonadotropin cell damage, like tumor, trauma, suprasellar surgery, okay, infiltrative disease, apoplexy, could be carcinoma, could be Cushing, endocrine, iatrogenic, okay, or could be narcotic use, could be
Narcotics.
severe systemic illness, diabetes, hemochromatosis, steroid, testosterone, okay, morbid obesity,
Okay.
can cause hypochondroplasia too. I think because of the estrogen. Okay, now, so if you're a 34-year-old Caucasian female with a blood glucose of 102 and free T4 is 4.6, so what is the immediate step to control these symptoms?
You have a glucose of 102
Yeah,
and elevated free T4.
yeah. And you have racing heart.
Yeah. If you're having a racing heart, if you have a high heart rate, you want to do beta blocker first.
Yeah, good job. Give him propranolol.
But you're just giving me minimum information. Oh my goodness.
Yeah, but you're smart. You're picking it up. That's cool. You answer most of the questions. I'm so proud of you. So what do you expect gonna happen to the parathyroid hormone in chronic pancreatitis?
Chronic pancreatitis,
Yeah.
parathyroid hormone. Okay, let's say chronic pancreatitis, maybe they have a vitamin D deficiency, which can make their PTH to be elevated. I don't know.
Yeah, good job. And the phosphate, calcium will be low too. Okay, patient having erectile dysfunction. Okay. So what is what diagnostic test that you want to do on this guy?
Erectile dysfunction. I don't know. Maybe you want to check the testosterone.
No, you do a nocturnal penile tumescence test.
Oh. Okay, the one you want to see if they.
You put a tape. If it work in the morning, if it's broken, then that's
you do
psychogenic,
what?
huh?
You put a tape.
Yeah, like something like a tape. So all men have normal erection in the morning. Okay, so if he's able to do that, then that's a psychogenic erectile dysfunction. But if he's not able to do that, then that's organic. Okay?
Yeah, my question is, how do you put a tape?
Yeah, like it's
to measure the length?
No.
I don't know. I'm just asking. I don't know what you mean by put a tape.
No, like yeah, some of them they do like tape, or some of them they do like Rigi scan, which is they do like kind of a sleep study. Okay, so you know like male have normal erection in the morning.
Right.
So it gets hard. So this is one.
So
Yeah.
if they're able to have normal erection, then it's due to maybe some other problem.
Yeah, if they have no,
if
they have
But
erection.
if they don't have normal erection, then it's organic, right?
Yeah. If they have normal erection in the morning, that's mean the cause is psychological because the functionality is okay.
Right.
Yeah, that's how it is.
I knew that. I was like, a tape. What do you do with a tape?
Yeah. Like they do this thing. Or they do Rigi scan. Like Rigi scan also they do that.
Mm-hmm.
They do a whole sleep study.
Okay.
Okay, and tells you if there's an erection happening. No. Okay, let's go next. Now, if you're a 65-year-old guy with erectile dysfunction
Mm-hmm.
and gynecomastia, early morning testosterone is low. So what's best next step?
Okay. So ED, erectile dysfunction, testosterone is low, gynecomastia. So something is going on. So it might not, like what you said to do, they can do it, and likely this is gonna be like something to do with hormonal imbalance. I
Yeah,
don't know. Maybe give them testosterone.
yeah, you want to measure serum prolactin.
Okay.
So what are the features suggestive of testosterone deficiency?
I am not really good with those ones. That area.
Oh, you're not good with testosterone?
Mm-mm.
Yeah, so testosterone deficiency cause incomplete sexual development, could be libido
Mm-hmm.
decreased, potency
Mm-hmm.
decreased,
Mm-hmm.
decreased early morning erection,
Mm-hmm.
gynecomastia, decreased shaving frequency, small testes.
Mm-hmm.
So normal adult testis length is 4 to 7 cm, volume is 20 to 25 ml. Okay, they may have hot flashes, severe hypogonadism, cause low sperm count,
Mm-hmm.
osteoporosis. Like this is like male menopause. That's what it is meaning.
Mm-hmm.
Okay, okay. If you have potassium of 2.7,
Mm-hmm.
okay, with right hilar fullness and mediastinal lymphadenopathy.
Right. Hilar fullness and
Yeah,
what?
and mediastinal lymphadenopathy.
Mediastinum
Yeah,
adenopathy. Uh-huh.
plus hypertension and muscle weakness.
Hypertension. Mm-hmm.
What's going on here?
That's a little weird. I was gonna say cones, but I don't know. Cones doesn't cause LAD. So, how old is this person? Does it matter?
49.
49. Hmm. I don't know. Maybe lymphoma.
So this is a small cell lung cancer that can cause ectopic ACTH, causes
Oh, yeah.
hypokalemia, hypertension, muscle weakness.
Okay. Small cell. It makes sense.
So what test do you order for Cushing syndrome?
Oh, Cushing syndrome, you can do cortisol. Early morning cortisol.
Late evening salivary cortisol, 24-hour urinary cortisol, and low dose dexamethasone suppression test. Those are.
Mm-hmm.
Okay, so if you have palpitation, weight loss, and the thyroid exam shows 2.2, left-sided nodule. Radioactive,
Thyroid exam. Okay.
yeah, radioactive iodine shows increased uptake only in the left thyroid nodule,
Mm-hmm.
but the rest of thyroid is decreased. So what's going on here?
Decrease uptake on only on one side.
Yeah, so increased uptake in the nodule and everything else is decreased. It's your diagnosis.
Toxic.
Excellent. Toxic adenoma.
Adenoma.
Toxic
Mm-hmm.
adenoma. Now, if you are a 45-year-old woman, that's a good question. I like it.
Mm-hmm.
You had watery diarrhea,
Mm-hmm.
muscle cramps, episodic flushing, and potassium of 2.1.
VIPoma.
Yeah, vipoma, cause watery
Vipoma.
diarrhea,
Mm-hmm.
achlorhydria, flushing, lethargy, nausea, vomiting, muscle pain. What lab finding would you expect here?
So you find hypokalemia, right?
Yeah, you can find also hypercalcemia
Mm-hmm.
due to increased bone resorption. You can have hyperglycemia due to glycogenolysis.
Mm-hmm.
And stool shows secretory diarrhea, the increased sodium. And how about the osmolar gap? How much is that going to be?
It's gonna be low.
It's going to be less than 50, yeah. How do you diagnose it?
Do you check for, is there any, I don't know, do you go do, I think you do you do lab first before you do, I don't know.
Yeah, you
I know
are.
you can do like a CT later to localize the tumor, but is there a lab you do before that?
Yeah, you can order VIP level will be more than 75.
Okay, VIP level.
And then you
Okay.
do CT MRI to localize the tumor.
Mm-hmm.
Okay.
VIP level.
Yeah. If you are if you're a 55 homeless man or history significant for chronic recurrent abdominal pain, your hemoglobin is 7.2, your calcium is 6.
Mm-hmm.
Okay. So what is causing this hypocalcemia that you have?
Maybe chronic pancreatitis.
Hmm?
Is it
Yeah.
chronic pancreatitis?
So the most important, yeah, it could be, but the
ADEC,
most
malabsorption.
hypomagnesemia is the most important cause of hypocalcemia, especially in alcoholic. Why?
Mm-hmm. Hypocalcemia. Um, Two things. One, they say that um, alcohol has a direct toxic effect on the kidneys, which can cause, like a fast elimination of the magnesium. And then there's the other theory that has to do with, yeah, that other one I don't remember.
Yeah, so the hypomagnesemia causes decreased release of parathyroid hormone, okay, and hypoparathyroidism induced by low magnesium is not associated with elevated phosphate level, okay, as seen with other causes of hypoparathyroidism. So
Say it one more time.
hypoparathyroidism due to magnesium is not associated with hyperphosphatemia.
Mm-hmm.
Yeah, just keep that in mind. Okay. Now, if you're a 36-year-old woman
Mm-hmm.
with examination of the neck shows 2 by 2 cm discrete
With
non-tender
what?
2 by 2 cm
Mm-hmm.
discrete non-tender firm and mobile nodule in the left thyroid lobe without cervical lymphadenopathy. So what's initial step that we should do now?
I know you can. So you already did the ultrasound, showed that, right? So fine needle aspiration, if any.
No, you measure TSH and ultrasound, and then you do a aspiration. Yeah, you're right. Yeah, good job. Yeah, aspiration only if the TSH is normal.
Mm-hmm.
So what lipid finding on hypothyroidism do you expect?
It's gonna be high.
Yeah, hyperlipidemia.
Mm-hmm.
Okay. So what are the causes of acute hypocalcemia?
Acute
Yeah,
high what?
hypocalcemia.
Hypocalcemia.
Mm.
So I am going to say like a surgery. If you had surgery right now, like a thyroidectomy, parathyroidectomy, neck surgery, acute. What else? I don't know the other ones if they will cause like acute or chronic, like infiltration, like yeah, this about what do you call acute and chronic is a little bit confusing. I know those ones, you know, if you do surgery now, you can have like a low calcium.
Yeah, next, sir.
Also,
Mm.
what about pancreatitis also will cause that, like if they have, yeah, pancreatitis can cause that. Autoimmune disease, will I say chronic or acute? I don't know. Yeah, those are the things that I would say like right now, if thyroidectomy, parathyroidectomy, neck surgery. The other ones can be chronic or like autoimmune disease, Wilson, hemochromatosis, pancreatitis. I don't know. That's all I know.
Yeah, so neck surgery like parathyroidectomy,
Mm-hmm.
pancreatitis, sepsis,
Mm-hmm.
tumor lysis syndrome,
Mm-hmm.
acute alkalosis, chelation like a blood citrate transfusion,
Yes, yeah. Mm-hmm.
LDTA, and foscarnet.
What? RTA?
Hmm? Transfusion and foscarnet.
Okay.
Okay, and
All right.
EDTA, which is sodium ethylene diamino tetraacetic acid,
Mm-hmm.
can cause acute hypercalcemia. Okay, now high parathyroid hormone.
High parathyroid hormone.
Yeah, plus osteoporosis. So what's your diagnosis?
Uh, talking about primary.
Yeah, primary hyperparathyroid. Okay. How do you manage HHS?
Oh man. So first of all, you're gonna do hydration, give a lot of normal saline, and then also start them on insulin, regular insulin, IV insulin, and then also with our potassium. Then if you get to glucose of 250, right, then you can now, I think, switch them to IM, right, and stop the IV. And then there's something else that you do. That's really like, those are the quick ones you do. Normal saline, IV regular insulin, plus potassium. And then once you bring the sugar to like 250, then now you can switch to, you can add dextrose, yes, because you don't want them to go into hypoglycemia.
Yeah, like, it's just like a DKA, normal saline,
Mm-hmm.
okay, insulin and potassium. That's
Mm-hmm.
it. Okay. So if you have serum osmolarity of 314, urine osmolarity of 1,
Hold on, serum osmo 314,
yeah, and urine osmolarity is 124,
124. Okay.
and serum sodium is 150.
Serum sodium.
Yeah, and you have urinary frequency, and you drink a
Mm-hmm.
lot of fluid every hour to alleviate your thirst. So what's your
Mm-hmm.
diagnosis here?
Hmm. So your urine osmolality is concentrated. Serum urine osmolality is 124. Serum is elevated. So I'm thinking diabetes insipidus. Or it can be also polydipsia.
What can cause?
Either one.
What can cause?
Huh?
What can cause central diabetes insipidus?
So central will be things like a trauma can do that. Also surgery can do that. Also infection. Yeah. Those are the three big ones that I know. Trauma, surgery, infection, or infiltration.
How about what can cause nephrogenic diabetes insipidus?
Nephrogenic will be things that can affect the, I think, the receptors. What are those things? Maybe like drugs.
Yeah, lithium hypercalcemia and AVPR2 mutation.
Mm-hmm.
And there is important thing to consider. Central diabetes
Okay.
insipidus cause hypernatremia, high serum Na.
Mm-hmm.
Primary polydipsia causes low serum Na. While
Low serum. Okay, low serum sodium.
nephrogenic diabetes causes normal serum Na. So this is how you differentiate both, okay?
Say it one more time.
Nephrogenic diabetes insipidus, they have normal serum Na, sodium.
Mm-hmm.
Okay. And the other thing, in central diabetes insipidus, they don't have thirst mechanism. While nephrogenic, there is intact thirst mechanism. So they drink a lot of fluid. The other thing, primary polydipsia is most common with antipsychotic and anxious middle-aged women. Okay?
Mm-hmm.
I don't mean you. I'm just saying in general.
Oh my goodness.
You're not anxious, yeah.
You are funny. Am I an old woman? Oh mine.
Okay. Now, so if you are a 35-year-old man who presented with fatigue, weakness, erectile dysfunction, a blood pressure of 98/72, okay, there is delayed deep tendon reflexes. Okay, so what is it? What do you think is going on here? Hypoglycemia, there is 56 glucose. This is a very tough case. What do you think?
I'm thinking hypopituitary, whatever. What do you call it? Pituitarism.
Smart, good job, hypopituitarism. Because you know, many things are damaged. So when I say erectile dysfunction, the prolactin axis is damaged.
Mm-hmm.
When I say hypotension, that's the renal axis, RAS system. And not just the RAS, like the ACTH, the adrenal axis is damaged. When I say delayed deep tendon reflexes, the thyroid system is damaged.
Right.
So many things damaged here. So the T4 will be low, the cortisol will be low, but the aldosterone will be normal because aldosterone has nothing to do with the pituitary. Okay, just be careful. So what could cause hypopituitarism?
Okay. So what I remember, if you have like things like it can be primary, like a tumor in the pituitary. It can also be due to infiltration, like a hemochromatosis. It can also be due to Sheehan syndrome, right? Radiation, TB, trauma also. Yeah, those are the ones I know.
Yeah, good job. TB, trauma, sarcoidosis, radiation, mass, pituitary apoplexy, Sheehan, lymphocytic hypophysitis, adenoma. Okay, so you have, there will be ICTH deficiency, what could cause fatigue, weight loss, hypoglycemia, eosinophilia, postural hypotension. Okay, secondary adrenal insufficiency, and there will be hypothyroidism, central, cause cold intolerance, constipation, and other stuff. And gonadotropin will be deficient. Like so, in male, cause infertility, loss of libido, and in women, amenorrhea and infertility. So that's the summary for it. So good case.
All right.
Good case. Okay.
Yeah, time to go.
Oh, what is it?
You've been late. Yeah.
Oh, you're gonna bring your son?
My son.